Hello, Mitchell. How you doing today?
You know what? I'm gonna complain today.
You gonna complain?
Yeah. Nah,
Right.
I'm just doing good. I'm just messing with you.
Okay, that's good. So,
How about you?
it's been busy, rotation.
Yeah, honestly, I haven't heard from you in like 2 years.
I went back to Mars for a week.
I know, what the hell, man?
So, just
So what are we
so our
talking
viewers
about today?
know, I'm on an infectious disease rotation right now, which is why we're doing antibiotic topics. So these are kind of big for doctors and mostly pharmacy too, because we just make sure the doctors are doing the right ones. So today we're doing carbapenems, which are very like broad spectrum, which means they cover a lot of bugs or bacteria, if you want to call them that. So let's get into it. So what are the main carbapenems? Do you know them?
No, I do not.
So you have ertapenem, which isn't as good, but it's good if you don't need to cover too broad. Meropenem, doripenem, and imipenem. The hospital usually uses meropenem or ertapenem, where I'm at right now. So it just depends on the situation. So what do you know how they work?
No, I do not.
So the same as the last medication we covered, so they just inhibit the cell walls of the bacteria. So very basic mechanism. This is how penicillins work, cephalosporins, basically all your beta lactam medications, which are beta lactam's like a certain ring structure that these are classified as. Which I'm not getting into that because no one likes organic chemistry here. So
Hmm.
so the spectrums for them. So ertapenem covers strep, staph, H. flu, MCAT, E. coli, Klebsiella, Peptostrepto, which is a fun word to say, and B. fragilis. So staph and strep are gram positives. H. flu, MCAT, E. coli, and Kleb are gram negatives. Peptostrepto is a gram positive anaerobe. B. fragilis is a gram negative anaerobe. So people ask you what covers gram negative anaerobes, you can say ertapenem. And then you have your other guys. They cover everything above, but they also cover Pseudomonas, which is a big bug in medical. So if they have antibiotics in the last 90 days, they're at risk for Pseudomonas or MRSA, depending on your facility, and Enterococcus as well. So there's an abbreviation called APE. So Acinetobacter, Pseudomonas, and Enterococcus. That's like the three main things that ertapenem does not cover. Acinetobacter's on the slide. I don't think the other ones cover as well, but that's like iffy. But it's just an easy way to remember what that doesn't cover.
What,
Dosage. Is your
what is
question?
Kleb?
Klebsiella.
Kleptilla. Okay.
Yeah. You don't see it. You don't see it too often, but like you usually see E. coli a lot more. Klebsiella is still a little bit common though. So main dosage you need to know, at least for the pharmacy test I need to take, and I don't need to know it. You probably don't need to know it either. That's no reason why you need to know it. So none. You can up to date it or Micromedics or Lexicompetent if you need to find the dosage of what you need to use. How are they eliminated, Mitchell? You have a 50-50 chance.
Um, let's keep it PG and let's say renal.
Yeah, it's renal. So, renally eliminated, which is seems like that's a trend with a lot of the
I
antibiotics.
mean, yeah, I was gonna say like pretty much all of them. Not
And
all of them, but like.
so we'll do like a kickback for last episode. So, what cephalosporin is not renally eliminated? Eliminated.
I do not remember.
Ceftriaxone. It's one of the why it's also has kind of a broad spectrum. That's why we use it in the hospital all the time. But it's also doesn't need to be renal adjusted. So like in your old people, you can use it without really caring about their kidneys. So that's why that's used. Side effects. You should know this one. You know.
Seizure with something, GI, diarrhea, and rash.
Yeah. So seizures of
Why did
accumulation.
you abbreviate diarrhea? Why didn't you just type it out like D? It could be anything.
It could be anything, but that's for mystery, you know. If you read my pharmacy notes, it's your like side effects NVD. That's all I put. Nausea, vomiting, diarrhea for most of the stuff. So yeah, that's basically the main thing with your penicillins is those side effects. You see that a lot of the time. So just to recap the key points of this, they work as a cell wall inhibitor. Ertapenem does not cover ape, so that's Acinetobacter, Pseudomonas, and Enterococcus. Now the Meropenem and Doripenem and Imipenem, they do cover Pseudomonas and Enterococcus, which are two big ones that Erta does not cover. So renally limited and can cause seizures, GI upset, diarrhea, rash. So yeah, I mean that's simple. These are safer than most of them.
Well, the rash part, it's.
Just wait till we get to fluoroquinolones, which might be the next episode. They're really bad. They can cause peripheral neuropathy, permanent too.
Peripheral neuropathy.
Yeah, so that's something diabetics get from their diabetes. And these drugs, these antibiotics, can give it to you permanently just by giving you the antibiotic.
That's insane how just a small dosage of a drug can just completely mess you up so bad.
This was actually just recently found out like a couple years ago too, so it's something that we didn't know about for a long time. These are also drugs that are abused by doctors all the time because it covers a lot of bugs.
Neuropathy is whenever you can't sense like the very ends of your like feet or fingers, and that's why they have cuts, and they don't treat the cuts, and then the cuts get infected, and then they have to amputate. Well, they get necrosis or sepsis or some sort of infection or some sort of bacteria or whatever in it, and they have to amputate, or sometimes they have to do dialysis, or it's really bad.
Or just treat with these antibiotics too, which then you get other issues like more peripheral neuropathy. So.
But like it makes you think though, because like such a small, like a microgram or a gram, however much of this can give you this, and it makes you think like how much of like actual healthy food or bad trash food, like fast food or whatever, affects your body and you don't realize it. Like, you know what I mean? Like, have you ever thought about like the dosage of like it's like a microgram or like 1 gram, and like your whole body is out of whack and like you're dizzy or whatever. But then like you are eating like fast food left and right, and you're like eating super like 25 grams of sugar every like Starbucks drink or whatever, and like you're not even thinking about how it affects your body. Like
that's insane.
It's insane how much your food can affect you, and you don't even care. Like,
there's a lot of doctors that focus on that now. It's called functional medicine. I'm not really sure if that's actually a thing, but that's what the name that doctors call it. It's functional medicine, using your food to heal you.
Well, I don't think like fruit can heal you. I mean, okay, I don't know. All right, so I don't have the studies or read anything, but like I personally don't believe, as far as my knowledge, I don't believe that food can heal you, but I do believe that healthy food can help your body live longer, better, in a better state.
Yeah, that's why I'm iffy on this subject, because they were like, oh, you eat all this healthy food and you'll cure your cancer in 4 weeks. I'm like, no, that's not how that works.
Well, yeah, because like, I mean, it's not like, I mean, your body will get rid of toxins while you introduce good stuff, right? It's like kind of like you stop drinking alcohol and you start drinking water, then your body will get rid of alcohol at some point, and that's where you feel hangover and then you stop. So maybe I don't know, maybe I'm talking out of my ass here, but like maybe it's just like letting it out of the body and then introducing good like good, you know, proteins and like good stuff from fruits and vegetables.
Yeah,
But I
maybe.
don't know. Curing? I don't. That's stretching it a little bit, dude.
Yeah, that's why I can't go with it, but well, maybe I'll make a
Yeah,
video on that sometime after we read up on it, but it's a lot of reading
yeah,
to do.
yeah, we should. I'll read more.
So, thanks for watching, guys. We'll see you in the next video where we talk about how to study for nursing school. So, see you then.